Well, let's talk now to Dr. Gillian Wright from the campaign group Our Duty of Care. Good morning.
Good morning.
So this will be debated in the Commons. What are your thoughts?
Well, I represent doctors and nurses across the UK who are hugely in sympathy with those at end of life and would campaign and work for the best palliative care, but would also oppose any move to the introduction of assisted suicide, particularly because we are concerned that it would adversely affect those who are most vulnerable. So those who've maybe had chronic mental health problems, those with a mild learning disability, those maybe who are homeless, particularly those who might be under a pressure to die. We're really concerned about coercion. It's very difficult for a doctor to determine that from a relatively brief appointment. And we're concerned that this is the wrong intervention at the wrong time. The NHS is in crisis, as we know, and palliative care lacks proper funding. So we need to address that.
Two doctors, that is going to be the safeguard, say, supporters of this bill. You're still not convinced? I mean, one doctor might have an interpretation. Another doctor may say, hold your horses, I'm not convinced here.
And absolutely, that would happen in some situations, and that would be good. But the Royal College of Psychiatrists has said that it's actually very difficult for doctors to determine coercion, for example. It's difficult for them, and psychiatrists are not even particularly better. Probably social workers are in a better position to assess that. But we're really concerned. There's lots of issues about this, concerns about prognosis. It's actually very difficult to determine some cases exactly what somebody's prognosis is. It's sometimes very difficult to determine their capacity if they are actually an understanding of what the interaction, of what the intervention would be, that it is lethal medication to end their life. So it's hugely important that we think really clearly about this and think whether it's the right intervention for us. And we're so concerned when we know that 1 in 4 people in the UK don't get the palliative care that they need. That's Marie Curie data. They don't get the psychological support, they don't get the social care that they need, but yet we would legislate to allow them the means and the support to take their own life within 2 weeks was what was proposed in other bills. It's just the wrong way round. And I guess I remember working in a hospice scenario when people came in, perhaps they were desperate and they said, I can't go on, but with relatively straightforward things, we could help them so that we could treat an infection or help their pain a bit so that things were manageable. And so I don't minimise the distress, but there are things that can be done, and we should, as a society, endeavour to make sure they're available to everyone in that situation.
So you're saying with more money, more funds going into palliative care, maybe social care as well, the kind of safety net that supports people when they're living with a long-term condition, and also when they get to end of life, that would improve matters, you think? That would lessen the argument for assisted dying?
Because palliative care has multiple dimensions. So it is about treating physical symptoms, so helping pain, breathlessness, vomiting, helping to make those more manageable and patients more comfortable. But it's also hugely about psychological support, about helping people have the time and space and support to adjust to their illness, to adjust to their different limitations, and to help them think through the things that are important to them. And actually what we would hope is that people would have the best death, that they would find meaning in the last few months of their life and be able to have a supported and comfortable death. And actually, that's what palliative care teams will be doing across the country today, is provide dignity in dying, that they would provide the best care for people. And that's happening, but it's just not available for everyone. And undoubtedly people are distressed when they go into acute services and then go home again with not very much support.
But the thing is, I guess some people, the end of life for many is extremely painful and there is no quality of life, and it can go on. You can be in a state which is causing you, not only yourself but the people who love you, incredible distress, both mental and physical. And people listening to this would say, why do you have the right? Why does that side of the argument have the right to tell me that when I've had enough, I know I've had enough. Everybody around me's had enough.
Yeah.
See what I mean? I know it's not a black and white issue. It's so nuanced. But that is what it comes down to, isn't it? Who has the right to say when they've had enough?
Yeah, and I absolutely understand this is a difficult and complex and sensitive issue, and it's really important that we discuss it, and that's why it's helpful to have this debate. But I think that there are both real concerns for those who are suffering at the end of life, but also real concerns for those who might be made extremely vulnerable by this legislation. And those are particularly those with recurrent suicidal thoughts, those who are exceptionally lonely, those who have chronic depression, and then have an added illness, those who are homeless, those who might be in abusive relationships and be under pressure from someone else to take their own life. Those who may feel a burden on caregivers. So we know in Oregon that about half of people cite feeling a burden on caregivers as one of the reasons, not the only reason, but one of the reasons that they ask for assisted suicide. And it is, the more you know about this, the more concerning it becomes, actually. And also just that it's not straightforward. Some people have real problems, and some people have seizures after taking the medicines. Some people are sick. You know, what happens at those points? How do we intervene then? It's really complicated.
Thank you for joining us, Dr. Gillian Wright from the campaign group Our Duty of Care. Lots of